Joining us for this week's Your Health segment is Dr. Kashif Munir, Medical Director of the University of Maryland Center for Diabetes and Endocrinology at the UMMC Midtown Campus, also Assistant Professor of Medicine at the University of Maryland School of Medicine. Doctor, thank you for being with us.
Thanks for having me, Jeff.
So many people have diabetes and deal with it well. How large a problem is it?
Yeah, so that's a good question. So in the United States now, they say almost 30 million people have diabetes. So if you count the whole population, that's about 1 in 11 people. But most people, I think, if they just think about family, friends, colleagues, almost everyone knows somebody with diabetes or themselves has diabetes.
Not to mention people who have diabetes and don't know they have it.
That's right. So they say about a third of people actually walking around might have diabetes and don't even know it. And another almost 3 times as many people that have diabetes have something called prediabetes.
Those people who have it and don't know it, what symptoms might they be experiencing that they ought to be more attuned to?
Right. So sometimes it's pretty hard to even tell. But a lot of the symptoms, so I can demonstrate, drinking too much water.
Being thirsty all the time?
So being thirsty all the time, urinating more than usual. Sometimes people will get up at night and have to, keep using the bathroom, and that's something that that should alarm you, or at least make you aware that you should get tested. And sometimes it's more subtle. You could just be a little more tired than usual, or a little more run down, and you're not able to do the things that you usually were able to do.
Is there an urgency in getting that diagnosis? Many people might want to delay having a diagnosis. Can you live for a long time without knowing about it?
Right. So there is an urgency in that treating diabetes can really delay the complications. And diabetes, really, it's a disease of blood vessels. It affects the small blood vessels in your body, like the back of the eye, or to the kidneys, or to the nerve endings. And then it can affect big blood vessels, like the blood vessels in your heart, or going to your brain, and cause things like heart attacks and strokes. So that sounds very scary, but the good news is if you do catch it early and you treat the risk factors, not just the blood sugar, but also things like your cholesterol, your blood pressure, you can really prevent a lot of these complications. So it is important to diagnose early and treat aggressively early.
What does diagnosing diabetes consist of? Is it a simple blood test?
Mm-hmm. So there are different ways to diagnose it. One of the easiest ways is a fasting blood sugar. So there's just different cutoffs. It's kind of a continuum. So there's normal blood sugar, and then after that we have what's called prediabetes. So that's the blood sugar between 100 and 125, and then 126 and higher is considered diabetes. There are also other tests. There's a test called a hemoglobin A1C, which many people might have heard of. That gives you a more longer-term assessment of how your diabetes might be doing, or it can also diagnose diabetes. And then we can do something called a glucose tolerance test, where we actually give you some glucose and then measure your blood sugar at 1 hour and 2 hours, and that also can help us diagnose it. So there's several different ways to diagnose it.
Let me remind our viewers, if you have a question about diabetes, treatment, how to prevent it, give us a call. The number's up on the screen. You can also tweet your questions. The Twitter address is @MPT News. Type 1 diabetes, type 2 diabetes, how different are they?
Right. So that's the big question. So the two main types that we know about are type 1 and type 2. Type 1 is less common. It's maybe 5 to 10% of the population. And that just consists of your body. Actually, it's an autoimmune condition, meaning your immune system attacks the cells that make insulin, the beta cells in the pancreas. And so those cells slowly are destroyed, and you just can't make insulin, and so you need to treat that with insulin. We used to call it, or we used to refer to it as juvenile onset diabetes, but now we understand that people that are older also can get this type 1 type autoimmune reaction. And then type 2 is the more prevalent type of diabetes. So that's maybe 90 to 95% of people. And that has two what we call core defects. So there's what's called insulin resistance, and that's when your body is still making insulin. So unlike type 1, you might still be making insulin. Sometimes you're actually making a lot of insulin, but your body just cannot respond to it the way it should. And then the second is that the pancreatic cells that make insulin slowly do fail as well.
How much of the incidence of diabetes is tied to genetics, your family history, predisposition versus environmental factors?
Right. So both Both factors are very important, and this gets back to even the types of diabetes. And so there are type 1 and type 2 are the major types, but then we're learning a lot more about these genetic forms of diabetes that are passed on through the family, and they don't really fall into type 1 or type 2. They're due to certain defects in what we call transcription factors, which have to do with the enzymes that control your blood sugar, and so those can also cause diabetes. But in general, genetics plays a big part, especially in type 2 diabetes. So most of the time, if you have type 2, you can identify a relative, whether it be a parent or a grandparent, uncle, aunt, that has also type 2 diabetes. But there's two kind of hits to it. Then there's the environmental factor as well. So what we know is that if you're predisposed to diabetes, if you do really well with your diet and exercise and really aggressive with lifestyle changes, you can actually prevent it from occurring.
I've heard of people who lost a lot of weight and then no longer had diabetes.
Mm-hmm. So that also can happen. So with diabetes, we say nothing's permanent. It's a dynamic disease. You can lose a lot of weight either through just very strict diet and exercise, and even losing about 10% of your weight. So if you kind of put that in kind of more identifiable terms, if you weigh 200, if you lose about 20 pounds.
Yeah, I guess I've heard about it in the context of somebody who weighed 300.
Right. Or 300 and lose 30 pounds, even that can actually get you off a lot of medications. But then if you lose even more weight, you can revert back to what we call normal glycemia or normal blood sugars. More often than not, that happens after surgery. So a lot of patients or people now are undergoing surgery for weight loss, and a lot of these people have diabetes. And so after that surgery, a lot of people will go into what we call remission, or their diabetes kind of goes away, and they can maintain normal blood sugars and don't need any medication any longer.
Let's grab a phone call. Baltimore City, this is Don. Don, thanks for the call. Go ahead.
Yes, I was concerned about how old you have to be to have diabetes, and if you're young, like 4 or 5, or in a child's age, could it be treated then instead of waiting till people get old enough to verify it?
Thank you very much.
Yeah, so that's a good question. So the age, again, it depends on the type of diabetes. So type 1 is more common in younger children. So I think he said the age of 5. But we are seeing type 2 diabetes, which we used to call adult onset. We're seeing it in teenagers a lot now. And so a lot of it has to do with environmental factors, the weight gain, the stronger genetics that seem to be creeping up. And so there's really no age limit per se. But and I think the big question is how to prevent it. So can we stop it from happening? So if you know you're going to get it at 30, can we just stop it at the age of 5? And so again, it comes back to hard work. It's diet and exercise, and so that's the one tried and true treatment that we know will delay or prevent the onset of diabetes in a lot of people.
What's happening with medical treatment? Obviously, we don't have a silver bullet pill yet, but what do we have? What's on the horizon?
Yeah, so there's a lot of things. There's a lot of new drug classes for type 2 diabetes. There are medicines that work that also actually cause weight loss and improve your blood glucose, whereas before a lot of the treatments actually cause weight gain. And then I think one of the most exciting things that has happened over the last few years, one is that there are newer monitoring devices that kind of check your sugar all day long. And so they're put in under the skin, and it'll give you a blood glucose estimate every 5 minutes. And with that, you can couple it with a insulin pump now. And so one of the biggest things on the horizon, which just got approved by the FDA or the Food and Drug Administration recently, is that there's what we call a closed loop. So meaning the sensor will tell the pump what the sugar is and how to adjust the insulin, so the patient can kind of manage things a little bit more hands-off.
That's kind of an artificial pancreas.
Like an artificial pancreas. So it's an early iteration of that, and so there's going to be a little bit of human element still involved, but we're moving towards that, and we're at, in the future, we really envision that people will be able to manage this just with this artificial system.
Baltimore County, this is David. David, thank you for calling. Go ahead.
Yeah, Doc, I just wanted to say I've been diabetic/pre-diabetic for 20 years, and I discovered, I went on it with this diabetic study through Hopkins, and they hooked up a meter to me, and this meter showed me what my sugar levels were in a graph every 15 minutes, and I realized what I was eating I was eating, for instance, shredded wheat in the morning with 0 sugar, but it had a lot of carbs. And in the morning, that was throwing my carbs, way up above 200, or 250 or something. And so after that, I immediately realized what I was eating was throwing my sugar levels real high. So I immediately lost, not immediately, but within 6 months, I lost 33 pounds just going on a low-carb diet. And my sugar levels are now normal. I'm no longer pre-diabetic or diabetic, whatever.
David, yeah, glad you called. Thank you very much. And in the direction you're talking with constant monitoring, maybe it becomes an app at some point.
Yeah, so that's actually one of the companies that has these monitors. You can actually hook it up to your phone, and it'll deliver the data right to your phone. So that's kind of the future. But I think David makes a very important point that a lot of times we just look at sugar and not realizing that carbohydrates, it's the same thing. And so, for example, if you eat a piece of white bread, it's just like eating a teaspoon of sugar. It's exactly the same in terms of causing your blood glucose to rise. So I think the point is that when you look at labels, a lot of these things are sometimes marketing almost gimmicks, and so you have to really learn how to read a label and look a little bit deeper and see that the carbohydrates is really what matters, or matters most in terms of affecting blood sugars.
Let's go out to Caroline County. This is Susan. Thank you for the call. Go ahead.
Yes, I wanted to know how effective the ketogenic diet is that you see so much in the press now for combating diabetes.
Thank you very much.
Right.
What does that mean?
So ketogenic diet, there's a lot of different diets that are reported to be ketogenic, and those are usually low carbohydrate diets. So your body uses carbohydrates, which convert to glucose as a fuel. And so if you eat really low carbohydrates, then you start to oxidize fat or burn fat, basically. And so one of the byproducts of that is you make ketones. And so the thought is these ketones might suppress appetite, and so this is one of the big fads that's out there now. It actually does work for a lot of people, meaning that eating very low carb can actually be very effective in lowering blood sugars. And so I think the issue is that we often get or want to pin one diet and this is the golden diet for everyone. But it doesn't work that way. Different people respond differently to different diets. And so what we do is we work with people. We try to individualize our goals and our treatment plans with people so we can really tailor the therapy to that person. And so maybe a very low-carb diet works for person X, but not for person Y. But it is something that does work for people.
Squeeze in one more call from Page County, Virginia. This is Robert. Robert, thanks for the call. Go ahead.
Yes, I'm a type 1 diabetic. I've been diabetic from age 35 up to present, which is about 29 years now. And I just wonder if they got any new type insulins and that could help my diabetes. I'm what they call classified as a high-low diabetic. One down like high, and the next one lows.
Robert, we'll get you an answer on the air. Best of luck.
Yeah, so I think this is where this artificial pancreas system really could make a big difference. So I think part of this, there are newer insulins out that are more what we call physiologic, meaning they kind of mimic the body's insulin production much more tightly. There are insulin pumps that help you do that. And then now with this sensor pump combination, for these people that are very labile or have very high blood sugars and very low blood sugars, this is really going to help that type of person in trying to even things out. So I think technology is on the way to hopefully help a lot of patients just like that.
Very good. Dr. Kashif Munir is Medical Director of the University of Maryland Center for Diabetes and Endocrinology. Sir, thank you for being with us.
Thank you, Joe.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.